For this video, I'm going to show you how to assess the lumbar spine using something called motion testing, and then from there we can follow on to a very simplistic mobilization technique. So a patient side lying, their legs at 90 degrees like you can see here, and I place their knees onto my thigh, so I'm taking part of their weight, and then I can use myself as a rocking motion to flex and extend his hips, which flexes and extends his spine. Anatomically, PSIS, the posterior superior iliac spine, is in line with S2, and then the iliac crest is in line with L4. So palpate the lower lumbar and just feel for motion. And typically the first level that you feel will be L5 and S1. So they call it the LS, lumbosacral junction. And then naturally you can start palpating high levels, yeah, and then you can just make your way all the way up, yeah, to the lumbar spine, and then you can almost isolate and just think which one is moving. This one's a bit stiff, okay, as you are coming down through there, okay, around there. Now, just by doing this technique, you are literally treated. So every time I flex, I'm opening and extend, I'm closing the facet joints. But then what you can do is look at this angle. If I do this to his legs and slowly bring his legs down, then this causes a side bending to the left, which is opening the top facets and closing the bottom facets. This right hip is externally rotating, the left hip is internally rotating, so I can use the hip mobility to open the top facets in here. And by lifting his legs the other way, then I'm going to be opening the bottom facets, okay? And again, the legs are reversing their role. So you can almost use the hips to internally, externally rotate to open and close the facets, and you can use that as a lovely little mobilization technique for that lumbar spine. You can do an MET from here. So let's say, for instance, you get the patient to slowly push your legs up, so like this, gently. So as he pushes up, internally rotating right hip, externally rotating left. And as he relaxes up to 10 seconds, we have a window of opportunity, so I can slowly bring his legs down where the tissues are now relaxed. And then that allows me to mobilize the spine more effectively just by using the legs after I've done an MET. So this is quite a nice way of assessing the lumbar and then using the hips to promote mobility at the lower lumbar spine. Thank you for watching.